Hi, I'm Blake Gillette. I'm an orthopedic surgeon at Canyon View Medical Group in Spanish Fork. So people that are candidates for joint replacement are people who've been dealing with arthritis pain, usually from osteoarthritis, kind of the wear and tear arthritis. Some people do suffer from rheumatoid arthritis, which presents its own difficulties and challenges, but anyone who's been suffering that for many years, months, as a candidate, and as long as they've at least attempted some conservative treatment generally, that includes injections, physical therapy, modification of your activities, just to try to improve weight loss is a big one. But once you've exhausted those conservative options, generally it's time to start to consider a joint replacement. So with joint replacements, generally, this is the standard, what's called a total knee arthroplasty or total knee replacement. It's the most common type of replacement that's performed. These components, after the bone is cut, are generally cemented into place, the most common form. And then once they're cemented in place, this plastic liner is popped in between the two metal surfaces. And so the people are now rubbing metal on plastic rather than that bone-on-bone arthritis pain. So the pain goes away with the arthritis, and now they have metal on plastic. Now, one other option in certain populations, and this is dependent on your x-rays and where you actually have arthritis. The way I like to look at it is if they have arthritis in one compartment of the knee, which most commonly is the inside part of the medial side of the knee, then why not replace only that part, especially when the other side, the lateral side, is unaffected and the patellofemoral joint's unaffected. People who have partial knees, as you can see here, it's still the same metal implants on both sides of the bone with the plastic insert, but people generally say that the knee feels more normal when they have a partial knee replacement. That's because we maintain all of the ligaments, the collateral ligaments on the sides and then the two cruciate ligaments on the inside. Generally with standard total knee arthroplasty, at least one, if not two, of the cruciate ligaments are sacrificed just to allow the implant to be put in the correct position. So one other option people can have, some people have isolated arthritis to only the patellofemoral joint or the joint behind the kneecap. So what rides right here in the end of the femur bone or the thigh bone. And even that joint by itself can be replaced, again, isolated fashion, because if you don't have arthritis in these two compartments, why take away bone that's basically normal cartilage? So when we look at these joint replacements, if you have a component in arthritis in two of the three, generally you'll get a total knee replacement. But again, if it's isolated to either just this joint, the medial, and even in more rare instances, the lateral side of the knee, you can replace those with just partial knee replacements. So here at Mountain View Hospital, we do these surgeries all the time. We have a group of highly trained, skilled professionals helping both the surgical technicians, the surgical assistants, as well as the anesthesiologists who are up to date with the most recent type of anesthetic blocks, which are very important for all types of surgeries, so as not to have complications, because nothing's worse than doing a great surgery, but yet there's a complication from, say, a nerve problem because of the block. So we have anesthesiologists that have been trained in these techniques using ultrasound guidance so that we don't affect the nerves in a bad way long term.